Dear viewers and readers, welcome to the special program of Daily Ajker Patrika. I am Muhammad Shafiullah. We are with Ms. Rana Flowers, UNICEF Representative to Bangladesh. Ms. Rana Flowers has been serving in this role since 5th August 2024 and she bearing over 35 years of experience in child development, international development and policy advocacy. She has previously served as UNICEF representative in Vietnam, China, Cambodia, Mongolia, and Belize. We will discuss key child and public health issues in Bangladesh, including UNICEF priorities, maternal and child health, malnutrition, immunization, climate change, child protection, and policy priorities. Hello, Ms. Rana. Thank you very much for joining with us today. How are you?
I'm very well, thank you, and thank you for welcoming me here.
Thank you very much. You have been working as the UNICEF representative to Bangladesh for 1.5 years, and you bearing more than 3 decades of global experience. How would you describe your experience in Bangladesh?
Well, I've been here going on 2 years in August of this year. I think Bangladesh, it's a fascinating country. It's a country of remarkable hope, and among the people, it's an incredibly resilient and strong people. But I've also noted significant challenges that the country faces.
Bangladesh has made progress in child protection, maternal and child health over past decades. What improvement stand for UNICEF and which areas still need urgent attention?
Yeah, look, I think the focus for UNICEF is always on how do we give children the best possible start in life, and that is across all areas, making sure that they have access to vaccinations, to good health care, to preventative health, making sure that their nutrition is as strong as possible, that they have early childhood education opportunities and education, they're protected from abuse, etc. And that investment that countries make is very important because it is fueling the human capital development for the country today, but also for the future. So understanding why you invest well in those social sectors is very, very important. And I think a key challenge for Bangladesh has been a very low, globally, ranking very low in terms of the investment to key sectors like education. Health is very low globally, to social welfare and to women and children's protection areas. All of these areas have suffered from a lack of investment in the past, which in my view and in my assessment means that you're facing systems that aren't as strong as they should be. You're facing systems that the investment that is made is perhaps going heavily to one part of the system. So let me use health as an example. So you've got a fairly heavily funded tertiary health level. And you have less emphasis on primary health care. And primary health care is delivering health services where the people live. It's the most accessible of the levels, and it's the cheapest because you are preventing illnesses and diseases and other approaches from becoming so severe that people need to end up in the hospital system. So you want to try and protect your hospital system, which currently in Bangladesh is overcrowded. You want to be able to do much more of that prevention at the community level through your primary health care. And a good primary health care system will have a very solid nutrition approach within it so that families, so that parents are aware of just how important good nutrition for their babies, for their young children, for their adolescents, how critical that is to not just their health and physical health. It's important to their mental health, but it's also really important for their educational achievement. And we know so much more today than we did previously because of MRI scanning, etc., on what works and what doesn't work, and how important nutrition is to feeding the brain and to ensuring that children are growing both physically healthy but also intellectually healthy. So you have over the last decade or so in Bangladesh, you've seen remarkable gains across all of the sectors, as you said. In terms of health, we've seen maternal and child mortality come down significantly. We have seen improvements in areas like, very slightly, in areas like child marriage, the rate of child marriage. We have seen a little bit of improvement in an area that I personally consider to be critical across all of the areas that affect children, which is birth registration.
Okay.
In terms of nutrition, we've seen a reduction in stunting. Now, stunting is when you have enough food, but you're not eating the right kinds of foods. So children who eat all of the sweets and salty food at their school exit will suffer often from what we call chronic malnutrition or stunting.
Ultra-processed food.
It's not the right kind of, it's not giving the body what it needs, so it's not giving the brain what it needs as well. So that has gone down, and that's very good news. What I think is disturbing, however, is that in the last multiple indicator cluster survey, in this last household survey that was done across Bangladesh, we saw that wasting of babies and young children increased to a degree that was very unacceptable. So that when a child is wasted, it is purely they're not getting enough food. So it is aligned with poverty most often.
Okay.
It can be aligned with abuse, but most often poverty. And the fact that we've seen an increase in that speaks to the number of families who are simply struggling to be able to put the right amount of food on the table and to be able to ensure that their children are getting what they need. I think in terms of health, again, a success is the degree to which the system has been established in Bangladesh to deliver safe vaccines for children. And the take-up of those vaccines is magnificent. So absolute success. I think in a challenge at the moment is purely a process challenge, which is to make sure that the funding and that the process is timely. So we have faced, in the time I've been here at least, we've faced several vaccine outages. And when you have a vaccine outage, it means that children will miss getting their vaccine, and that puts them at risk of death. And even when there is an outbreak, what you're trying to do with vaccines is to dramatically reduce the number of children who are exposed. You're also trying to reduce the burden of that disease on them, and you're reducing the burden on the hospitals. I think personally as a parent, it's reducing the burden on parents, because the pain of watching children suffer, the pain of watching children face life-threatening disease is terrible.
Right.
And the more we can use vaccines to address that, the better. Yeah.
MICS 2025 has highlighted several important indicators. Which findings concerned you the most and why?
Okay, so the household survey that was done, as I said, it gave us some clear positives in terms of what's going well. I think I would list, at least for me, the areas that raised red flags and said to me, we need to pay more attention to these areas. One is definitely birth registration.
Okay.
You cannot possibly know how many children are not in school or how many children are not vaccinated unless there is a good birth registration system. And birth registration in all countries is the first child right. It gives every child an identity. It speaks to them as having dignity and respect as a person who counts. And the fact that the birth registration levels remain so low in this country is a challenge, and it's something I'm very eager to support the government to address. I know the new government is very motivated to look at birth registration. I'm very pleased to see that focus. And UNICEF is ready to do the communication campaigns to really support them to look at how to do that very, very well. I think a second area that stood out, and this is a part of this survey that hasn't been done in many countries at all, I think we're only the second country in the world, was to look at lead poisoning levels in children and pregnant women. And what we found was that while only 8% of the women were impacted, and I say only, any lead poisoning is dangerous. So the fact that they had above severe levels is worrying. But what we found through that survey is that more than half the children had lead poisoning. And the more we have looked into the numbers and and disaggregated those numbers across different parts of Bangladesh, the clearer it is that the lead poisoning is worse in the richer parts of Dhaka. So Dhaka as a whole is severely affected by lead poisoning, and we have to understand what are the industries, what is causing that.
Okay.
And then we have to be able to stop it, because any form of lead poisoning affects children's brains. So they won't get the educational achievement, but it's more than that. It affects their brain, parts of the brain that also manage behavior. So you have an outcome there. So lead is the second area. I think the third is wasting for me. Definitely the fact that we've seen an increase in that level signals we need to do more. And I think the issue for wasting is you can address it.
Okay.
There is a solution to wasting. There are ready-to-use therapeutic foods that can be given to parents that they give to their children on a daily basis that can address the fact that they have these micronutrient deficiencies. Okay. And that product we've also worked now to have produced in Bangladesh. So there's a locally produced product. So that means there's an even closer solution. We just need to have trained nutrition officers in the primary health care who can help identify the children at risk. It's easy to do. You use an armband to check and distribute and support them to use well the products to stop the wasting. Now, once they get to wasting, they also need often hospitalization. So it's much more expensive for the system. Okay. So keeping them out of that bracket is really critical. I think a fourth area that saw a sudden increase from the last survey 5 years ago is child labor. Okay.
Malnutrition remains a major challenge. How is UNICEF supporting the government to reducing standing wasting and micronutrient deficiency?
Yeah, so look, I think the first area that UNICEF works on is very much working with the relevant ministries and parts of the ministries to ensure a very good understanding of why nutrition is so important.
Education, health ministry.
All of those. And if we don't get the nutrition approaches right, particularly for the first 1,000 days, then we miss an absolutely critical development window for children. There are two windows that we identify. One is that first 1,000 days, the second is in adolescence. So the first is really about building nationally a much stronger nutrition workforce and training doctors and health professionals to be able to screen children and identify children at risk. No question. I think the second is making sure that there are products in country, preferably locally produced, Bangladeshi produced products that will and can be used for children both in the home, as I said, the ready-to-use therapeutic food, or the products that we use in hospitals to be able to treat children. They need to be readily accessible and they need to be available across the country. We don't want families travelling to be able to get care for their children. I think the third area is reaching parents, getting parents to understand the importance of good nutrition. I think the fourth is the government is starting to address. They're introduced with the introduction of the family card and the introduction of what we call social protection benefits to the most vulnerable families. That money is gold for poor families. It allows them to buy the kinds of foods and the products that they need to be able to feed their children well. So that initiative is very important. Again, tied to the importance of birth registration to make sure we know where the children are, but an absolutely critical change.
Okay, let's talk about immunization. How do you assess Bangladesh's progress in routine immunization and the introduction of vaccines such as HPV, rotavirus, and PCV?
Look, unquestionably, vaccination and the immunization drives that Bangladesh have done, it is a star globally in terms of being at the depth and the depth of the population in Bangladesh makes vaccination for any country extremely challenging. But to be able to go out and have a national average of about 85% of children reached through regular vaccination, that's a good result. That means you're blocking the disease from being able to take hold. What I think is troubling in that picture is that, and I was quite shocked by this when I arrived, that the rates of vaccination in rural areas are better than those in urban. I've never seen that anywhere else in the world. And I believe it's related to the fact that urban health is not managed by the Ministry of Health, that has tended to have to be managed by NGOs and others.
Local government.
And local government. And it's disparate. It's not working for children, and it's not working for primary health care to the degree that it needs to. So being able to ensure, and the Ministry of Health does now manage immunisation for everyone, regardless of whether it's urban or rural, that's critical to be able to get those numbers back up. We know that in the urban areas, you have these overpopulated parts of each of the cities. You have a lot of people who've migrated because of the climate crisis, etc. So you have particularly challenging to be able to access and to be able to ensure they get the vaccines. But I must say, and there have been two major vaccines that have been rolled out in the last year alone. Yes. One is the typhoid. Conjugate vaccine, and the other one is the HPV. So the typhoid is to stop the suffering of children and their families, take the pressure down off the hospitals, but also just to save children's lives. That one had tremendous reach. I think we reached about 92% of the population with that vaccine. That speaks to a system that is functioning.
Right.
And it speaks to people who understand why you vaccinate your children, why you protect them from these deadly diseases. The second one, I will confess, I didn't predict would go as well as it has, and that's the HPV vaccine. That is to stop cancer in women.
Right.
And you give it when the girls are adolescents in order to be preventative against the cancers. That one reached 97% of the targeted population, which again speaks to a system, speaks to a communication system as well that is able to build trust in people, to allow them to understand these vaccines are procured from only those who meet rigorous standards. They are quality vaccines. They are handled always in a way that protects the vaccine, the quality of the vaccine. And I think with that knowledge, people went forward and did accept the vaccines, and it's been a magnificent result.
Okay. Adolescent health issues, including maternal health and non-communicable disease risk, are rising. What strategies is UNICEF prioritizing to address these challenges? Yeah,
look, I think when I looked at the indicator cluster survey and the results, one group stood out for me, and it was adolescent girls.
Right.
And they came up in the numbers in areas that were quite shocking. So the area that I expected and am saddened by is child marriage.
Right.
Very high in this country. And related to that then, obviously, are some of the other indicators. So one was high maternal mortality, highest among the 15 to 19-year age group. Those bodies are not built to be having babies.
Right.
And For that reason, a number of the girls who do have babies when they're under 18, we see that they face more severe complications.
Malnutrition also.
Indeed, and we have very high anemia rates anyway among women. But we also see that their newborn babies die at far higher numbers. You add to that in the divorce numbers, it is the adolescent girl rate that is the highest. So when I look at child marriage and I listen to the arguments and I listen to families trying to protect the dignity of their children, I do question that.
Yes.
Is dying in childbirth, is being divorced as an adolescent, is that dignified? I think we have to help the population sort of debate this well and understand the costs that are being paid. I think adolescent girls also, as you said, the malnutrition rates in adolescence are very high. There are certain vitamins and minerals and supplements that we want young girls to take for their health, but also for their future as mothers. And that is an area that could do, again, your primary healthcare system, if that were functioning better, would be able to support that. Young girls are also the targets of increasing levels of violence and gender-based violence, and there are disturbing jumps in the attacks on young girls that we're seeing across Bangladesh. So that's another critical area for them. In terms of the non-communicable diseases, obviously all of those start in childhood. They start right from the time the baby is conceived. And again, how we get that nutrition and behaviours established in that early period will establish the degree to which people are vulnerable to the non-communicable diseases later in life. For young girls, we do see that the nutrition plays an absolutely significant role, as I said, but there are also other burdens. A lot of the non-formal work is done by women. More than 90% is done by women. Women don't have the same access to the health insurance and health care. And therefore it's a whole sort of ecosystem that we have to look at in order to be able to support our adolescent girls to have a much stronger health, nutrition, mental health basis. When we look at the different generations with mental health, we're seeing that the last generations are particularly impacted. COVID played a significant role in driving mental health challenges. In Bangladesh, it's not as openly talked about as it needs to be. And seeking help is not done as frequently as it should be. So there are thousands of young women who are suffering, and it's also young boys. You know, we're talking at the moment about adolescent girls, but it's equally true for boys who need to get some support and who need to get help, who are denied that. And I think the statistic is around 93% of those who really should get counselling and support are not receiving that.
Child marriage, violence and online exploitation remains threats. What new intervention is UNICEF implementing to strengthen child protection, and how do you evaluate progress so far?
Look, in all these areas, for UNICEF, we're not interested in doing small projects or little itsy-bitsy things here and there. We really do, our job as the UN is to work with the government to build the systems that reach every child. So if we're talking about education, we try and work with them to support change that will benefit all children across the country. And it's the same in the health system. So we definitely work with the Ministry of Health, but we work with a range of development partners and NGOs. If we're talking child protection and we're talking this increase in numbers, again, any intervention that we offer, it's not just working with the ministry, it's not just getting funding to be able to support innovations, etc. It really is looking at all of the different areas that are impacted. So for all of the challenges that a child faces, there'll be some practice that needs to change. So the training of health workers, the training of nurses, the making sure that they have the right commodities. So the nutrition products, etc. That's the supply edge of that. There's a communication part that we work with. So we have an enormous reach across the country. We have tools like MENA to try and help educate people and give people just the information they need that would allow them also to make key changes. When it comes to protection, and as you said, it's not just in the streets that we're seeing this massive increase or in the homes, it's also online.
Right.
And it's the fact that we're seeing a very abusive, attacking, particularly to young women, attacking that is based on beliefs that young women aren't entitled to be educated, that they're not entitled to work, that they don't have rights in these key areas. And I think being able to have the good voices speak up, to have those who don't agree with those approaches, we need to see them raise their voices much more and to be more active.
Urban migration has increased pressure on slum area. How is UNICEF supporting children living in their high-risk urban settings?
Right. So as I said, we try and look at achieving national change, but we also focus very specifically on vulnerable populations.
Okay.
So obviously those who have migrated, who are living in some of the slum areas like the Coral slum, these are specific target areas for UNICEF's work. And because we address children and children's rights, we are working with more than 11 of the ministries on the different areas.
Okay.
And it means for those living in the slum areas, we're trying to do a whole of child approach. So we're not going and just doing, vaccination in an arm, but it really is about the whole health, nutrition, providing support through health interventions, ensuring nutrition teams, looking in establishing child protection teams and hubs within each of the slums who can support the local population in a range of areas, including if a child is being forced into child marriage or if a woman is being beaten in her home. You have the child protection and the protection hubs working to be able to get the community to support the family more and to be able to prevent those kinds of abuses. We have very innovative water systems established also in the slum areas to ensure that people have access to clean water. And we also help develop and construct and maintain the sanitation systems so that you have hygiene addressed.
What major obstacle does UNICEF face while implementing programs in remote and climate vulnerable regions?
Yeah, look, I think the climate crisis just highlights all of those sectors for children. It adds to the burden and it definitely impacts children more than any other population group.
Okay.
So you've got a climate crisis and Bangladesh is on top of the lists in terms of the impact on children, in terms of the degree to which the climate crisis impacts its economy, etc. And the goal in all cases, in my view, where we struggle, or one of the obstacles is a lack of focus on prevention and preparation. Okay. So I think you have, like in all governments, you have one ministry responsible for disaster response.
Right.
That's normal. They do an excellent job also of trying to address preparation. I think I would say where I see some gaps is what the role of the different ministries in also preparing. So we know, for example, in 2024, when there was flooding in Feni and Nokali,
right.
The hospitals hadn't prepared at all. All of the supplies were in the basement. They lost everything as a result of that. We know the education systems had all their textbooks piled up on the floors, so they lost all of that. There are simple things that each of the social sectors must do in order to prepare for emergencies, to build the resilience of their communities.
Okay.
I think another obstacle is obviously we want to move towards climate resilient buildings, so climate smart schools, as we call them, or hospitals. We need to have solar panels, we need to have lithium batteries, we need to have the range of areas. An obstacle in Bangladesh is that those items attract the largest luxury tax, whereas the lead producing batteries, etc., do not. Right. So we've got the wrong focus, if we're really trying to think about environmental impact and how we can support a change, how we can reduce the impact on communities, then we need to look at all aspects, including the taxation system. Other obstacles in terms of the climate crisis are that we are in those areas that are often flooded. You have quite a good organised system. Part of the struggle we face is there's a massive overturn of staff. So we train the coordinators in the centres, they leave. We train the nurses and the doctors, they move. Same with teachers. We see a big turnover of teachers. If you're going to have a community that holds together and is resilient to crises, it is the migration in and out really doesn't help in terms of being able to achieve the goals that we've set.
Okay. How does UNICEF ensure accountability, transparency, and strong partnerships with the government and when implementing large-scale programs?
Yes, yeah. So look, I think, as I said, our goal is to work in accordance with the government's vision. So we're waiting now to understand the new government's vision to be able to identify the areas that are absolutely critical in that vision that we can support. We obviously are underpinned by the Convention on the Rights of the Child, so we're very aware of what needs to happen for children, and we know what has worked in other countries and what hasn't.
Okay.
So we really do try and look at bigger picture. I encourage our team to have a 10-year vision. What's the change we want for children that we can help support the government to achieve? And then what are the milestones leading up to that? And I think having a really clear plan that we're working towards, really identifying key priorities. So primary health care, I've mentioned as one, really much improved nutrition support for families would be a second. Really being able to look at the whole education system and look at the quality. There are several areas where we have clear priorities that we feel need to be done. And we listened to children last year. We met with think tanks and others, and we identified a child rights manifesto that identified what are some of the really game-changing areas that a new government might address. And that manifesto was signed by the 12 biggest of the political parties, and I'm starting to see several of those areas already being addressed by the new government. They are things like increase the budgets to the social sectors. Already there's a commitment for that. It's about social protection for the most vulnerable, and you see the family card and e-health starting to come in, which are really positive when you're trying to address very vulnerable, poor, and their access to these services. Birth registration.
Okay. We have just one last question. Looking ahead, what are UNICEF Bangladesh top 3 priorities for the next 5 years?
Okay, well, I'd say for the next 1 year, birth registration. We're ready to roll and support the government to do a catch-up campaign so that every child is registered, and that allows the numbers to be counted and planning to go much more smoothly. I think over the next 5 years, primary health care with a good nutrition heart and very strong focus on the sort of hygiene, clean water and sanitation aspects of that. We've just done a survey of health facilities. Less than 1% meet the water, sanitation and hygiene standards. So we've got some work to be done, but that's okay. As long as we know where we're heading, we're absolutely committed to doing that. I think the second priority has to be related to lead at this point because of the very dangerous levels that we're seeing, and to being able to support good understanding of what that means, the impact on people, and then the need to really address the lead poisoning. I think the third area I would identify is definitely protection related. So really looking at how you reduce the gender-based violence, the violence in homes and communities against women and children in particular, but not only. Boys are also victimised in that picture. And I think being able to have services, a workforce in place to address that is critical. And if you allow me a fourth, it will be the climate crisis and how to really mobilise the different sectors to build that community resilience and work with the communities, the people themselves, to be able to address the challenges.
Okay, thank you. Thank you very much, Ms. Rana, for speaking with us today. We truly appreciate your insights and important works UNICEF is doing in Bangladesh. It has been a pleasure having you with us. On behalf of Ajker Patrika, thank you once again.
Thank you very much, and thank you for focusing on children's rights in Bangladesh.
Yes, of course. Thank you very much.